Hello everyone, my name is Angelita. Today we are discussing schizophrenia. My colleague and I in Group 6, Harpreet, Cheetah, Cheryl, myself, Bonnie, and Team 2. We are in the course of Community Mental Health Nursing at George Brown College. Our instructor is Miss Joyce Clammer. According to the Schizophrenia Society of Canada, there are over 300,000 of Canadian people who suffer from schizophrenia, although it affects men and women with equal frequency. Schizophrenia most often appears in men in late teens or early 20s, while it appears in women in late 20s or early 30s. Our group presentation will reviewing schizophrenia with people between the ages of late teens to mid-30s.
What's schizophrenia? It is a severe mental disorder characterized by profound disruptions in thinking, affecting language, perception, and the sense of self. There are three categories risk factors of schizophrenia: sociodemographic characteristics, predisposing factors, and precipitating factors. Causes may contribute to genetic inheritance. There's only 1% chances of developing schizophrenia if there's no history of schizophrenia in the family, 10% if parent was diagnosed. Chemical imbalance in the brain, imbalance of dopamine and serotonin. Family relationship. There's no confirmation to prove or even point out that family relationship might cause schizophrenia. However, some people with the illness believe that family tension triggers relapses. Environmental factors. Although there is no definite proof, stressful experiences often begin the emergence of schizophrenia, such as divorce, unemployment, poverty, traumatic experiences. Marijuana and lysergic acid diethylamide are known to cause schizophrenia relapses. Drugs such as steroids or stimulant can cause psychosis. Schizophrenic teenagers are similar to those in adult, but the condition may be difficult to recognize. This may be in part because some of the early issue of schizophrenic teenagers are common typical development during teen years, such as withdrawal from friends and family, a drop in performance at school, trouble sleeping, irritability, or depressed mood, and lack of motivation. Compared with schizophrenic adult, teens may be less likely to have delusions, but more likely to have visual hallucinations. What are the types of schizophrenia? Paranoid, unreasonably suspicious to others, disorganized, difficulty in performing daily activities, undifferentiated, schizophrenia that are not sufficiently formed or specific enough to permit classification of the illness into one of the other subtypes. Residual. This subtype is diagnosed when the patient is no longer displays prominent symptoms, and catatonic. A subtypes of schizophrenia involve disturbance in person's movements, such as waxy flexibility, stupor, mannerism, echolalia, or echopraxia.
Hi, my name is Bumi, and I'll be presenting prevalence, manifestation, and diagnosis of schizophrenia. Prevalence of schizophrenia in late teens to mid-30s in Canada is not well defined. However, Statistics Canada states that schizophrenia affects 1% of Canadian population. The onset is between 15 and 25 years. However, onset is earlier in men than in women. In men, it is between 18 and 25, while in women, it is between 25 and 35, even though men and women are affected equally. Clinical manifestations. Schizophrenia is a mental disorder that is characterized by delusions, which are false, fixed, and persistent belief that somebody that does not believe in something that does not exist. And there are different types of delusions. Delusions could be erotomatic. In this case, they believe that a star is in love with them. It could be grandiose. Here, they believe that they are special, they possess they possess special powers. It could be persecutory, where they believe that somebody is out to harm or to kill them. And they could be jealous too, where they believe that their partner is unfaithful to them. Another manifestation is hallucinations. These involve seeing, hearing things that do not exist, and it could be visual, it could be gustatory, it could be auditory, and it could be tactile. Some other manifestations are disorganized thinking, where their thinking is not in line with what they say. Their speeches are maybe inappropriate and maybe very incoherent. They have disorganized and abnormal motor behavior by maintaining some bizarre positions, and sometimes they are resistant to instructions. Other negative symptoms could be inability to cope, to function normally, low grades in class, and inability to concentrate. Diagnosis of schizophrenia. There is no blood work that can absolutely diagnose schizophrenia. However, the psychiatrists can make the diagnosis based on 2 or more clinical presentations, particularly hallucinations and delusions. Diagnosis for children, childhood diagnosis and adult diagnosis are really equally the same. Another tool that can be used by the psychiatric is what is called the Diagnosis and Statistical Manual of Dental Disorder, which is DSM-5, published by American Psychiatric Association.
Hi everyone, I'm going to talk about the treatment of schizophrenia. Schizophrenia is a disease which requires lifelong treatment even there is no symptom present. And it includes pharmacological treatment, non-pharmacological treatment and psychosocial therapy. Hospitalization may be required in severe cases. First of all, pharmacological treatment. Pharmacological treatment include medication such as risperidone. Risperidone is a medication which has less sedation effect than any antipsychotic drug. And olanzapine. Olanzapine helps to improve the negative symptom in the patient. Qutipine, ziprasidone, haloperidol, clonazepine. Clonazepine is effective for the patient who are resistant to treatment and improves the anti-suicidal symptoms. Now I'm going to talk about non-pharmacological approach. Non-pharmacological approach include sport therapy, family therapy, rehabilitation, psychosocial therapy, and psychosocial support, and CBT's cognitive behavior therapy. ACT is a multidisciplinary team approach which includes psychiatric, case manager, and social worker. And there's a cognitive remeditation. There's a short-term therapy, and that helps to improve the cognitive skill for the patient. Now I'm going to talk about the side effect of the medications. Side effects are restless, tremor, rigidity, dyskinesia, inability to sit still, cardiac arrhythmias, tardive dystonia. Let's talk about how to make a patient adherent to the treatment. The term simple helps us to remember the intervention for the schizophrenia patient. S means simplify medication regimen, imparting the knowledge. Involve the patient in the treatment so they can participate and they can help us to make a decision maker. Modify patient belief. Educated patient regarding the treatment. Patient healthcare professional communication. Leaving the bias. So don't judge the patient, respect them, evaluate adherent to current care plan. See if this plan is working. Otherwise you have to restart the program again. Thank you.
Now you learn about schizophrenia. So let me take you through a case scenario. Alex is 23 years old, IT engineer, was diagnosed as a case of schizophrenia and was on medication for the last 2 years. Past a couple of weeks, he stopped taking his medication and a relapse occurred. Alex became so lazy and was not interested in his work. Today, Alex ran away from his seat, pointing to a computer, and shouted about a snake that will bite him to death. And he is always suspicious of his family members and does not trust anyone. Today, he got admitted voluntarily for a psychiatric evaluation due to command hallucination telling him to hurt himself and others. So you saw a case scenario of a relapse. Now let's see what the family members or friends can do to help this patient and help themselves to treat a schizophrenic patient. So people living with schizophrenia, spirituality, faith-based support, spirituality can be a source of comfort and strength during treatment process. So, it is important to include prayer in recovery management for people of faith. Provide mental health support and protect their loved ones while allowing room for self-reliance. Keep a journal of all medications, medical visits, treatment, and legal actions they have undertaken. The helpers, the caregivers, or the family members, they can seek education and support for their own needs from groups specially designed for families. Now, the next concern is that whether the schizophrenic patient can have children or not. So yes, schizophrenic patient can have children. Parents with schizophrenia can reduce their risk of relapse by participating in peer group activities, taking their medications, seeing a therapist on a regular basis. Thank you.
prevention and dealing the relapse. Is a social interaction possible? Schizophrenia patients work together with healthcare team to choose a treatment plan that works for them. The most important part is managing the symptoms of relapse. Relapse is the phase in which symptoms get worse or come back. The following steps helps to take control of the illness and reduce the risk. First one, taking medication as prescribed. Second one, participate in therapy, for example, psychosocial therapy. Third one, focus on lifestyle, for example, substance abuse may increase the risk of relapse. And fourth one, address early symptoms of relapse such as absent-mindedness, difficulty in concentrating, insomnia, unexplained fear, and disinterest in people. Sometimes patients may feel difficult with social interaction. Social skill training is the best possible way to help patients to overcome social deficit problems. Caregivers can help patients to practice these skills at home. The role of community mental health nurse. Community mental health nurse plays an important role in identifying stressful events, assess stress response, educating communities, intervene to prevent or alleviate disease and disabilities resulting from stress, and advocating. Available resources for community health nurse and for the family. Diversion and court support, case management and supportive counseling, community service information and referral, assertive community treatment team. Other resources include Connex Ontario. It is a free and confidential health services for people suffering from mental illness. 24/7 mental helpline. The number is 1866 531 2600. Support groups, Schizophrenia Society of Ontario and Combeer. Combeer is a non-profit organization for people to overcome mental illness through friendship. Thank you.
The World Health Organization has recently adopted an action plan for mental health. They developed 4 objectives. First, strengthen effective leadership and governance in mental health. Second, provide comprehensive, integrated, and responsive in mental health and social service in community-based setting. Third, implement strategies for promotion and prevention for mental health. Lastly, strengthen information system, evidence, and research for mental health. In this conclusion, stigma still exists towards people who have mental health issues. Organizations such as World Health Organization with their action plan will help in this area. Overall, schizophrenia requires a lifelong approach and commitment for every patient. It is possible to live well with schizophrenia. As noted, the onset of symptoms on average seems to be from late teens to mid-30s, and diagnosing it can be challenging. The community health nurses has a crucial role to ensure that every patient with schizophrenia have the support they need to have prosperous life. Thank you for listening and watching for our presentation. This is Group 6.